Time. Today we have Assemblymember Ash Kalra, who had authored a bill to make universal health care reality in California, only to let it die without a vote this week. We'll explore why and what's next. Also, from exercise to art to cooking and even coding, a new platform has kids teaching other kids in an out-of-the-box way. It's an idea born out of the learning loss during the pandemic, and we'll talk to the co-founders of Tract. But first, the continuing debate over masks in schools. Parents and doctors are more and more disagreeing over whether students should still be required to wear face coverings in the classroom. So joining us live now to delve into the debate and the science is UCSF epidemiologist and family physician, Dr. Rita Hamad. Dr. Hamad, thanks for joining us today.
Hi, thanks for having me, Kristen. I'm happy to be speaking with you.
Well, I'm so excited about the opportunity to really discuss what you think, because not only are you an epidemiologist, you are the parent of a kindergartner. And this is interesting because I know you were adamant that kids should wear masks in schools, right? You supported the lengthy closure, in fact, of San Francisco schools, so caution. But now you think it's time to rethink the mandate. Why?
Yeah, I think the basic issue is that we as a society are doing a risk-benefit analysis right now to decide whether to make masks optional. Early in the pandemic, we didn't know much about the risk of disease in kids, and no one was vaccinated. And so the calculations then were clear. And I and others supported mask mandates, and they made sense. Right now, we know that kids themselves are at very low risk of severe disease, especially with the mildness of Omicron and with many of them vaccinated. And their families and communities are also at lower risk of severe disease. We know immunity is high from people either being vaccinated or having prior infection. And masks for adults are absolutely effective. But experts are now questioning their effectiveness at preventing infections in kids, especially the youngest kids. You mentioned I have a kindergartner. She definitely cannot keep hers on consistently for the 8 hours a day she's with her friends. And we know that, studies in Europe where masks for the youngest kids haven't been required, haven't led to surges driven by school outbreaks. So now the risk-benefit calculation is different. And that's why more experts are encouraging the state to make the mask mandates optional as soon as the surge in Omicron is over.
Are you saying that even unvaccinated children are somehow less likely to transmit it, to catch it themselves and to transmit it to others?
Yeah, I think the key is that kids are at lower risk of disease, so that even if they get it at this stage, they're not going to have severe disease, and that their families and communities have such high risk of, such high immunity that they're not going to get severely sick, so that the risk-benefit calculation has changed. There's still the potential for transmission, but the risk side of the equation has just changed now over the past 2 years.
Talk to us in terms of what the downsides are, right? We know that there are upsides to masking, right? You still reduce your chances for catching a cold, for example, or the flu, or getting COVID, even if it doesn't lead to severe illness. But have you seen some of the downsides that experts say in terms of developmental and emotional consequences? Have you seen that in your own kid?
So my kid is considered an English language learner at school because we speak Arabic at home. And so she went to school and she gets sort of the extra English language sessions with her teacher. And I would definitely say that, her pronunciation is maybe not as great as it could be. And that, for people from, thankfully I also speak English, so we can do that. But for a lot of families who are racial ethnic minorities or immigrants, that's more challenging. And so it's really critical for kids who are English language learners to be able to have that ability to see and hear their teachers and their peers.
Okay. From what you've seen, though, are kids actually objecting to keeping the mask on the whole day at school? I'm not talking about like your kid actually having a hard time keeping it on, she forgets, or it's kind of off, kind of on. But I mean, do they oppose it the way some parents do? Or do you think most of the opposition comes from parents who are projecting, thinking that their kids can't be happy that way?
Yeah, I think at least in San Francisco, I think a lot of kids have been normalized to this. It's sort of a cultural thing at this point where you have your mask on all day. So my daughter certainly doesn't object. And sometimes when we're about to go into a store, she'll say, Mama, get out my mask. I need to put it on. She knows. But at the same time, I could probably, if there was a rule that she had to wear a, big funky hat, and I told her to do that every day, she would. And the question is just, do we need to be doing that anymore? There are lots of things that kids can get used to and that, that we can get them to do every day. But the question here is that is it effective? And there's questions now about whether it's effective for kids to wear masks in school to reduce transmission, and is there harm? And there's certainly potential harm. And again, we were okay with those harms about the socio-emotional and the language development early on when the risks were greater, but the risks are less now. So we need to rethink that equation.
Yeah, you talk about the fact that it's been so normalized, especially in our region, right? But when you see, for example, a 3-year-old playing on a playground outdoors with a mask on, do you think to yourself, I mean, great if they want to, but that it's not scientifically necessary? Do you think that?
Yeah, I mean, I think that makes me sad sometimes that, I've been very proud of our region and SFDPH and our leaders, that they were quite conservative in terms of like having lots of protection measures in place throughout the beginning of the pandemic. It kept a lot of people alive. It kept a lot of people healthy. And now I worry that has become, that we're doing it because of cultural reasons and not for scientific reasons, because the science certainly tells us, and I would say, the vast majority of experts would agree that wearing a mask outdoors is, especially if you're just on the playground walking around, is not evidence-based. And so that makes me sad that we as a region that had really led in the evidence early on are maybe, veering from that right now.
I think what a lot of people struggle with is the conflicting messages and signals we seem to pick up, right? Just because, like this week, for example, the city of San Francisco lifted its indoor mask mandate for what they call stable cohorts of vaccinated people, right? So like in a gym, in the office. But then when you talk about kids 5 and 11 who are a stable cohort in their classroom, right? And here anyway, a lot are vaccinated. It just seems like there's lack of unity or uniformity.
Yeah, and I think that's why a lot of parents and physicians are starting to point out that disconnect. It's exactly what you just suggested. Like we're now allowed, when there's a surge, when there's a lot of cases, even adults were required to mask. And as we start to lift those restrictions for adults, now kids have had access to vaccines for months. And so there shouldn't be that disconnect. And I think that's why you're hearing a lot of these calls right now with the surge declining. And more and more kids with their vaccines, definitely.
So if that rule were not in place anymore, would you right now have your kindergartner go to school without a mask on?
Yeah, absolutely. Definitely. I look forward to that every day. So not having to pull the mask out of my pocket to hand to her on the way to the door.
And wash it all the time. And I do want to ask you if you think it's part of this is just the natural progression of a virus that can move quickly, the surges that can move quickly, right? Because it seems to just change before the battle is over. Like, because lately we've seen teachers in the Bay Area staging walkouts, threatening to strike if their school district didn't provide KN95 masks for not just staff, okay, the adults, but all the students. And now we're talking about, is it still necessary to mask the students? I mean, I just, it's sad to see people fight when it seems like that has passed, if you know what I mean.
Yeah, and I mean, we're in a pandemic. We have to be nimble. And I like to think that people are sort of staying on top of I mean, it is hard to stay on top of the messaging, but I think they've maybe gotten used to the fact that, when there's a lot of cases, we change our behavior. When there's less cases, we can sort of pull back a little bit. So for people who are worried, like, what about the next variant? What about the next surge? We'll deal with that if and when it arrives. But for right now, let's take advantage of, this decline in cases and give kids a little bit of wiggle room that the adults have already been getting for the past few months.
So would you have said that the KN95s made sense like early January, middle of January in schools for everybody, but at this point, maybe not as necessary?
I mean, I don't know that for adults, we definitely have evidence that KN95s, N95s are effective. We do not have the studies right now that tell us that for kids. We definitely have shaky evidence that cloth masks work. And again, we took that chance early on because there was a lot of COVID around. But I don't know that we have the evidence that kids can consistently wear them all day and keep that seal and not move around in them so that it's worth that investment.
I'd like to get your take on why you think kids aren't vaccinated more, right? This as we await approval for a vaccine for under 5s. But the 5 to 11 group, I think the uptake is not that high. Like even in San Francisco, right? Isn't it like 40%-ish, something like that, statewide 20%? Why do you think that is?
That's a great question. And I think that it might be that parents are doing this same kind of risk benefit calculation, that they've heard that kids don't get as sick from COVID, and maybe the sort of the risks in terms of like potential vaccine side effects haven't been conveyed. There maybe hasn't been enough information that the risks aren't that great in terms of the vaccine side effects. I know for my daughter, especially because it would allow her not to have to quarantine every time there was a case in her class. I got her vaccinated in November, as soon as I could get her an appointment. But I know that for a lot of parents, they're doing that calculation for themselves and not coming to the same place. And I think that we as public health professionals can do more to sort of reassure people about that.
All right, Dr. Ahmad, great talking with you. So great getting your take as both an epidemiologist and parent of a young child. Thank you so much. Really appreciate your time.
Thanks for having me.
Coming up, the future of universal health care in California. The latest push for a single-payer system failed, so we'll talk to the bill's main author, South Bay Assemblymember Ash Kalra, about what's next. We'll be right back. All right, everybody, thank you so much for joining us today. I see I got a bunch of you on Facebook Live. Right, but we are going to Ash Kalra, right? Is he in? I was going to chat with folks, but then I heard something from my producer, so I was answering. Hey, everybody, we're going to put you on pause for a second because I got to take care of some business, okay? Enjoy this beautiful shot of... Welcome back. Does universal health care have a future in California? The latest push for the progressive priority of a single-payer system is dead, at least for now. The bill, CalCare, was not put up for a vote in the state assembly by the Monday deadline. Assemblymember Ash Kalra from San Jose, CalCare's author, joins us now to explain what happened and what's next for the idea. Assemblyman Kalra, Ash Kalra, I wanted to combine your name because it just seems to be kind of cool that way. I really appreciate your time. I know it's been a tough week for you.
I appreciate you having me on. It's been tough for a lot of people because obviously we hoped that we were going to be able to get the votes for CalCare to get through the state assembly. Unfortunately, that wasn't the case. We fell quite short of that. But I do think that we put some cracks in the armor of the industry that's profiting off of our healthcare.
Well, Assemblyman, the California Nurses Association and your own speaker, Anthony Rendon, tweeted disappointment and criticism that you didn't put it up for a vote, despite the fact that it was not going to pass and everybody knew that. What's your response that you should have done it anyway, do you think?
Well, I was looking at it from a policy perspective, not a political perspective, in the sense that I know personally for me, politically, the best thing to do was to put it up for a vote. And it would have been beneficial for me to do that, to say that and show that I'm continuing to fight for the bill and for healthcare. But when it comes to the policy, we need more votes. And at the end of the day, we can't just manufacture those out of thin air. Many of those votes sit on the floor with me. And we just ran out of time because of the January 31st deadline to get enough of my colleagues on board. This time next year, we're going to have a number of new legislators, many of whom right now are campaigning in favor of single payer and specifically of CalCare. And I do believe that we can get a number of my colleagues on board as well. I don't think putting it up to a vote that was going to be, by all estimates, around a 2-to-1 vote, 2-to-1 either no votes or votes against it, would have benefited the policy. And so I put the policy above all else. And I think it allows it to survive another day and frankly another year, because either way it was not making it past Monday.
Yeah, you referred to, next go around when the legislative lines are being redrawn and there could be more progressives, lawmakers in the body. So we'll see what happens. But explain to our viewers exactly how a single payer system as you envisioned it might work, right? Is this kind of like Canada's? Explain to people, what that means in terms of what would change for them.
Well, it would be unique to any other system, partly because, you think about other countries, California has the 5th largest economy in the world. We can pool our resources, pool the buying power and the negotiating power of 40 million Californians in order to ensure that the healthcare provider you go to being paid for would be paid for by CalCare, but you would still have the option, the choice to go to any healthcare provider that you wanted to, including the one that you have right now. It's different in that sense from access to insurance or universal insurance access, which then continues to put the power in the hands of those that are profiting off of our healthcare and make decisions based upon their bottom line, not your health. And so it's very simply put, you would be able to continue to go to where you want to for your healthcare. The CalCare would pay for it. So
like Kaiser Permanente, for example, the HMO, like which part of it would cease to exist in California essentially? Like would it just not be the insurer, but it would still provide healthcare like with its doctors and nurses?
That's right. So the insurer wouldn't need to be there for you to get access to the doctors and the nurses. In fact, Kaiser is a great model in terms of CalCare. The integrated model works really well in how CalCare is set up. And so the only difference is instead of an organization like Kaiser having control of your healthcare in terms of who's providing it and the hospitals and the clinics and the nurses, on top of that, they also have control of the payment, which really, ends up creating a very administratively expensive process, a profit-taking process. We want to get rid of the tens of billions of administrative costs in our healthcare system and that profit motive that makes us have the most expensive healthcare in the world, expensive not just for families, but for businesses, and instead focus on the healthcare and the doctors and nurses providing the healthcare.
I mean, a lot of attention has been paid on the cost, which is estimated at $350 billion. I know you've talked about how right now we actually pay more collectively as a system, so it's actually cost savings. But who would pay more? Like, would it be taxed businesses, people who make more money? Like, where's the cutoff? Who would pay more?
Well, right now we pay the highest health tax in the world. It comes in the form of premiums, deductibles, copays. The average business spends $20,000 or more for premiums for one employee to have family insurance. The average payroll is 9.9% for businesses to give healthcare. So what we want to do is kind of separate employment from healthcare, have a progressive taxation system with a very modest payroll tax and income tax and a gross receipts tax. What that will do, it'll allow us to get companies now that refuse to pay for healthcare. They find, the Walmarts of the world only give 20-hour shifts for a reason. There's a reason why so many working class folks have 2 or 3 jobs. What that means is they're on Medi-Cal, and we as taxpayers are paying for their healthcare. Instead, we would have everyone pool their resources in a way that doesn't disproportionately harm the working class or businesses, but instead gets enough resources to fund the system, coupled with the majority of money, which already comes from state and federal funds.
Assemblyman Kalra, are you somewhat disappointed that the governor, despite pledging in 2018 to support single payer, has not or did not endorse your bill?
I think the governor just distancing himself from single payer healthcare, and this bill hurt the cause, because I think what it does is it makes it harder for us to get votes in the legislature, but when there are seeds of doubt as to whether there's a path forward. And there is absolutely a path forward. But I do think that it didn't help the cause for the governor to distance himself from a policy that he has previously on numerous occasions supported.
All right. Of course, there are other hurdles to clear. I know it's not just the assembly, you know, the state legislature votes. California voters would have to approve it as well. You would need a federal waiver. So it's a long process, but thank you for letting us know what's coming up next and that the battle is not dead as far as you're concerned. Assemblyman Ash Kalra, thank you so much for joining us today.
Thank you.
Coming up next, there's a really great innovative way to help your children recover from learning loss. It's an app platform called Track, and we're talking to the co-founders about its unique features after the break. All right, everybody, thank you so much for joining us. Be sure you stick around for the next segment. If you're looking for cool ways for your kids or grandkids to learn and you want something beyond Khan Academy, you'll want to see this. Be right back. Many parents have noticed the learning loss their kids have experienced since the pandemic, but don't know what to do. They may not have the tools or resources to support tutoring or enrichment. But now there's a learning platform for kids, by kids, in the topics that interest them.
Most people know how to make your average paper airplane, but I'll teach you how to make the world record plane and destroy them in any distance competition.
Joining us now to talk about Track.app, co-founders, former Palo Alto High School teacher Esther Wojcicki, whose nickname is the godmother of Silicon Valley, and entrepreneur Ari Memar, a former and early stage product leader at Uber. Esther and Ari, thanks for joining us.
Thank you so much for inviting us. We're really excited to be here.
Oh, yeah, thanks for having us.
Fantastic. Esther, your platform is called Track.app. Would you describe it as a Khan Academy, but the lessons are created by older kids for younger kids? Or you can take it to whoever wants to jump in.
Well, it can be described as a Khan Academy. Only thing, it's much more fun than a Khan Academy. And so one of the things that we can think about for Track is it's older kids teaching younger kids. And we all know there's no one more exciting in a kid's life than just a kid who is a little bit older. So that's one of the attractions of Track. And then I'll let Ari tell you some more about it.
Yeah, Ari, what sparked your drive to create such a platform? Was it the pandemic?
The pandemic was definitely a part. I think in everybody's life, you reach a point where you're saying, am I doing the most impactful work? And when you're seeing kids struggle, you're seeing teachers struggle, you're seeing parents struggle, it's kind of a call to action. Like, why can't somebody do something about it? And for me, I see the motivation that all kids have, and they want to be creators. They love to be creative. They love to teach. They're so passionate about all these different topics. And it's really a missed opportunity to channel that passion into something productive. Let's not do unboxings. Let's not do just pure game streams. Let's channel that energy into actually teaching and learning. And so that really was the inspiration for me. And Esther was my teacher. So I've seen it work firsthand. I've seen the power of peer instruction. I've seen the power of project-based learning. And so I really want to help every kid in the world have that opportunity.
Fantastic. I mean, we're showing, you know, the platform, and you have all sorts of different topics, from music, right, to art, to coding, video gaming, and, you know, folding paper airplanes. So tell us why you think it's important to have content like this, right? That's, I guess you could say it's academic plus. It's the plus stuff that kind of fosters the creativity. Why is that so important?
Well, I think the main reason it's so important is because it's kids and what they think is really important for them. And it's not adults telling kids what to think. It's kids talking to other kids about what is important. And we love to empower kids. And that's one of our goals. When kids do things that they think is important, they achieve mastery because they're really passionate about doing it. So that's one of my goals. Also, can we help kids achieve mastery and have grit? Now, Ari,
Yeah, Ari, we have only about 40 seconds left, but I'd love to hear how this works, right? So is it free to teachers? And how do students access it? Do they need to pay?
Yeah, it's absolutely free to teachers. So all teachers need to do is go to teach.track.app. They can sign up for free. They can add their students. Their students can teach through the platform. Their students can learn through the platform. And it's a homegrown product. So you're gonna have the luxury of having personalized support, 40 years of experience of Esther as a teacher, and a team that really cares and has attention to detail.
And there's a small subscription fee, isn't there, for like families, like parents?
For parents, it's also free if you use a promo code. So we can give you a promo code.
Okay.
You can use promo code WOJ, W-O-J, and it's also free for you.
Okay, fantastic.
Yeah, that's my nickname, by the way.
All right, we need
That's
to take a
your
short break on
nickname.
the air, but let's continue to talk about this on Facebook Live. We'll be right back. Okay, just in case folks missed it, what is the promo code again, just for our ABC7 viewers and everybody else?
W-O-J. WOJ.
Oh, okay, Watch,
Yeah.
your nickname, right, like you said.
Yeah.
So can I ask you, like, how do you find your content creators? I took a look, and they're all very engaging young people, right? Some are teens, some look like they're college students. Where do you get them from?
We get them from a few different places. So one, they kind of naturally arise from all the classrooms we serve. So there's a lot of very talented, very driven, very curious kids around the world who are experts in many things. So that's one source. The second source is Esther is tied into so many different communities that have student leaders in them. She was the judge at the Breakthrough Challenge. She's run the Palo Alto High School Media Arts Program. So all of these different communities are full of these very creative kids who, primarily use video to share and teach. So
Got it. Okay, so if you're a kid with a bright idea, can they just approach Esther and you, Ari, and say, I want to put my, I want to teach here on your platform?
You know what they can do? They can just go to create.track.app and sign up. We love them. We encourage them to sign up.
Fantastic.
We help them.
Esther, I think you know something about raising successful kids. Your daughter Susan is the CEO of YouTube. Your daughter Ann is the founder of 23andMe, and your daughter Janet is a UCSF epidemiologist. What kind of tips can you give to parents in terms of fostering that passion and drive?
Well, so the number one, it's in my book, How to Raise Successful People, but the most important thing is this acronym I created for the book called TRICK, T-R-I-C-K. So you want to trust and respect your children and give them a lot of independence as much as you can, collaborate with them instead of dictating, and always treat them with kindness. Let me tell you, it works in the classroom and it works in parenting. And so I have a lot of proof points. And so just try it out a little bit. You'll see it works really well.
All right, Esther and Ari, thank you so much. Congratulations on Track.app, and I'm glad our viewers were able to hear about it. Thank you. Thank you so much for joining us on this interactive show, Getting Answers. We'll be here every weekday at 3 on air and on live stream answering your questions. World News Tonight is coming up next, and I'll see you back here at 4.